So I'll start kind of with the pitch. Like, let's say I'm, later tonight, I start to feel sick. I take a test and I'm positive. What's the first thing I do? Do I run out to a pharmacy? Do I stay at home? I mean, how do I handle this?
Yeah, it really, I hate saying this, right? It depends, right? It kind of depends who you are, right? If it's you being a healthy young guy, yeah, go home. So let's break it down a little bit, all right? So let's say, yes, someone is out there, one of our viewers starts getting some symptoms and goes and gets one of those rapid tests from wherever, and it comes back positive. Okay. First thing to do is think about your own situation. Okay. Number one, if you are young, when I say young, I mean less than 65. If you're less than 65 years old, you are relatively healthy, no other medical problems, go home. Okay. That's what you want to do. Go home, isolate yourself, don't get anyone else sick. Right. And this is especially if you've already been vaccinated. All right. The chances are, if you are healthy, less than 65, you've been vaccinated, the chances you have to go to the hospital or end up in the hospital is going to be far less than 1%. Okay. So good for you. You're prepared, basically. Okay. Let's say now you're over 65 or you're younger than 65, but you have some serious medical problems. You have heart disease, you have diabetes, you have already pre-existing lung disease, something like that. You've had cancer, those kind of things. You need to be a little more careful. All right. If you're that kind of individual, you have a fever, you feel pretty ill, you do need to go see a doctor. And the reason for that is because for that group of people, for older folks, for those who are somewhat immunocompromised, all right, our treatments that we have, everyone's heard of Paxlovid, right? Or even the antibody infusion treatments. Those will decrease the chance that you have to be admitted in the hospital or that you will get very sick. So you definitely should go see a doctor, get evaluated, and see if you're appropriate for either one of those treatments to prevent your disease getting worse. So it really is two big groups of people, and it depends which one you fall into, what you do.
And is it fair to say that 65 up and those with like underlying health conditions, or just 65 and up?
Again, I would say both of those groups. Okay. So if you're 65 and up, definitely go get checked out. It may be that you're still doing well enough that you don't really need anything, go home and be okay. That's great, but don't decide that on your own. Let's let a doctor make that decision. Okay. If you're less than 65 and have some of those comorbid conditions, immunocompromising issues like I talked about, then yes, again, let a doctor decide whether it's okay for you to just go home and isolate on your own.
So let's say I am me, right? Let's say I'm somebody under 65 and I
Right.
test positive and I'm feeling sick. Is there anything I definitely should take or shouldn't take? People talk about vitamin C and immune boosters or
Sure.
even ibuprofen. Like, what's okay and what's not okay?
Yeah, any of those are okay, man. Listen, you don't need to feel like crap. Feeling like crap is not a necessity, right? I mean, so if you feel like garbage and you want to go get some Motrin, help yourself feel better, bring your fever down, NyQuil, any of those things are fine. There's really nothing wrong. That's why they're over the counter, right? Because those are generally safe things. Use it within the prescribed guidelines on the label. You're going to be good to go. Again, I've told this people over and over, there's no reason for you to suffer, man. If you feel bad, let's go get some of those things over the counter, make yourself feel better. Don't worry about masking fever or anything like that. Okay. Your body will figure it out. And if you're going to get super sick, you're not going to mask it with some Motrin. You're still going to be super sick and you're going to want to go into the hospital. The things to look for, that's the other part of your question, right? Let's say you are young and healthy, you feel okay, you take some Motrin, you feel better, fine. The things to worry about are these. Number one, passing out, okay? Seems obvious, but you got to say that out loud so people know, right? The other thing is if you have any trouble breathing. All right. I don't mean like, you used to be able to run a mile and now you can't do it. Well, that's normal. You're sick. Okay. But I mean trouble breathing, like you're sitting there watching TV and you're like, oh my gosh, like I have to take some deep breaths or I don't feel very good. Trouble breathing like that, get yourself to a doctor so they can check you out.
No, that's really helpful, especially that signs to watch, because people are like, all right, well, I was fine and I'm, feeling not so fine.
Right.
If a family member tests positive for COVID, does that count as just a normal exposure? Should I do anything differently? Should I also isolate? I mean, how do people handle something like that?
Yeah, also a really good question. Okay, with the variants that are going around right now, basically Omicron or Omicron light, right? That's kind of what's going on right now. Being exposed to someone in the family with COVID is not necessarily a huge big deal. I would not necessarily change your own patterns, okay? Especially, like I said, if you were already vaccinated. Now, don't go in there on purpose, right? So let's say, you know, my wife comes down with COVID. There's nothing I can do about having spent time with her already, but going forward while she's sick, yeah, isolate her in a room, you know, and you try to avoid more contact with her until she gets better. That's the smart thing to do, right? But there's no need for you, just because you're exposed, to run off and do a bunch of tests and stuff on your own if you feel fine. There's really no need to do that. There's no need for you to change your life, meaning you can still go out and go to the grocery store and do all those things that you do. Go to work, no big deal. What we do is, what we recommend for folks to do is monitor for symptoms. So again, see if you start coming down with the same head cold symptoms or whatever.
So one other thing I wanted to ask about, you talked about if you are vaccinated has been kind of the comma before each of these thoughts. You know, one thing we've talked about for a long time is people had always said this. I say always said, but people had been saying, hey, this may be like the flu, where the vaccines are something you get once a year, like a flu shot, to prevent this. Well, we're coming up for a lot of people now on probably a year since their booster, or if they haven't been boosted, their for their third shot. But let's say you've gotten all three shots and you're somebody under 50, and so you don't qualify for the fourth. At what point do you think we may be needing a fourth, or will we need a fourth? Will there just be a thing where actually it's not like the flu? I think that's a question in a lot of people's minds, because they're seeing people test positive, but they're not yet eligible for another booster.
Yeah, well, that's a question on my mind. So let's be clear. I mean, again, right now, let's just remind everybody that, you know, prior to two and some months years ago, let's say 2.5 years ago, no one even heard of COVID, right? So honestly, our experience with this disease is still not nearly extensive enough for us to make those kind of predictions, okay? There was some thought that, yes, this would be something like the flu, and then we would need a shot every year, but it's a little bit different than the flu, okay? The flu has several major strains, all right, that float around, and they just come and go. But there's several major strains, and they're all kind of the same every year. Okay, we just have to guess which strain it is. All right. The problem with COVID right now is COVID keeps changing, right? As we've talked about variants. Okay, it's not like the flu that there may be 5 or 6 stable variants. Right now, we keep finding new ones for COVID. So we really don't know where this train necessarily ends. We don't know where this picture necessarily gets completely drawn. So right now, we really don't know. And unfortunately, that's a question that's an answer that's unsatisfying for folks. Quite frankly, it's unsatisfying for me. I would love to know right now how to treat all of my patients here, right? And give everyone boosters that all need it. But I think at this point, we just can't predict for the greater population what that means. All we know right now is the groups that you pointed out, the immunocompromised, the older. We know that boosting helps them for sure. The rest of us, we don't quite know. We're just going to have to hang on until science gives us an answer.
What sort of guidance beyond what I've already asked so far are you giving to people, or what questions are you hearing that I haven't asked? Because I mean, you're talking to people every day.
Yeah, there are two real things, two main things that I tell people. Number one, if you haven't been vaccinated, for God's sake, let's go get that done. Okay, that I'm still telling people that. As you know, there's still significant swaths of our population that have not done that. Okay, need to get that done. It's really the best thing to do. Okay, but then the next thing, relax. You know, it's okay. All right, we are getting to the point now where we are considering what it's like to live with COVID. All right, it's no longer, I think, one of those things that should make us all run out and buy all the toilet paper in the world. We're not at that point anymore. So I think let's all take a step back, take a deep breath. But on the other side, like I said, be smart, get vaccinated, and then I think we can all live with COVID amongst us.
One clarification I want to get real quick, going back to, because people, you say relax, but in that moment when you get that positive test, that's easier said than done, I'm sure. And people are like, oh, am I sick? We just talked about already, and I don't want to rehash, like seeing a doctor. Does that mean your primary care provider? Does that mean go to an ER? Because a lot of people are thinking, oh, I need to go to the I mean, what sort of guidance would you give there?
I think that's a great question. The first step is going to be if you can get in with your PCP, right? I don't feel great, William. I'm telling you, I got a little fever. This isn't good. I definitely feel like I'm sick. Yeah. The first doctor you go see is the easy one. However, if we have those symptoms that we talked about, right? If I'm sitting in front of the TV and I feel like I'm breathing hard and gosh, I want to go lay down, but I can't make it up the stairs. Well, come on into the emergency room, right? So it takes a little bit of judgment there. Okay. But certainly the first step, if I'm just feeling a little bit crummy, yeah, go to your regular doctor, go to an urgent care, something like that, get your rapid test done, and then you'll know. But those other big symptoms, really high fevers, I can't eat or drink, or like I said, I can't breathe. Those need to go to the emergency room.
And then last thing I got for you, and I'll let you go. We talked about, hey, it's okay to get all that over-the-counter stuff. Is there anything that you guys have found or anecdotally have heard seems to be helping treat these symptoms, or is it treat each one kind of as they come, whatever that might be?
Yeah, and the main thing is this, right? If you fall into those high-risk groups, then yes, we have the antibody cocktails, we have Paxlovid. But really, for the vast majority of the rest of us, it's time. It's time that makes us better. And you hate hearing that from your doctor, right? Just go home. What do they say? Drink fluids, rest and get better. But that's what it is, and from the very beginning, you've probably heard me say this over the airwaves more than once. Once you get really, really sick with COVID, there's not a whole lot I can do for you. I'm just helping your body fight it off. Not like some bacterial pneumonia. I give you an antibiotic, it kills the bacteria. We don't have that. Okay. And let's be clear, even things like Paxlovid and some of these other things, they don't kill the virus either. Okay. Again, these are more ways of us helping your body fight the virus. So there isn't a whole lot that we can say, okay, well, this definitely works. What we know is prevention works. The rest of that, it's a lot of it is just kind of dependent on your own physiology.
Dr. Chang, thanks so much for walking through all that. I really do appreciate it. And I'm sure a lot of people will hopefully learn a lot from this. Thanks so much. You take care.
Yeah, anytime.
See you.
Guys.
Oh, yep.
I did have one question. It may help your interview or not, but
Perfect.
Kind of the same vein. What can we say to people who never got vaccinated for whatever reason, and then says something like, well, now tons of people are getting COVID who are vaccinated, so why should I go get my shot?
No, I think it's a fair question too.
Yeah, I think it's a question that you've gotten from the very beginning, right? Well, people who get vaccinated also get sick. Well, yeah, that's true, but they have a whole lot less chance of dying. So that's a good thing, right? And the chances of you getting sick are much, much, much lower, right? We said 97 to 98% effective at preventing disease altogether, and almost 100%, though not quite 100%, protection against hospitalization. So even though Omicron now has knocked that down, right? Omicron, because it's as infectious as it is, we're seeing many more breakthrough infections instead of like 5% breakthrough, maybe seeing 10 to 15% breakthrough. But again, those cases are not in general hospitalizations. And in general, again, those are not the ones that are dying. And I think that's the important thing. The other thing I will point out, it's a good question that Chelsea asked. Right now, if you just take a look, right, what percentage of folks are what number of folks are getting sick? Well, if you look at our positivity rates, we've gone from about 2% positivity rates to about 8 to 9% positivity rates. That's a lot right here in Dallas County. That's a 4-fold increase. But when you ask me, what about hospitalizations? How much have they increased? Well, they've only barely doubled. Okay, so you see again, because we have a lot of people vaccinated, because Omicron is a little bit less infectious, more infectious, but less severe, hospitalizations are actually staying relatively low, even though the breakthrough infections are high. So again, the effect of vaccination is very, very, very important because even if it doesn't completely prevent you from getting COVID, it can prevent you from joining me here at the hospital. And that is really the important thing.
No, I think we'll be sure to hit on that as well, because I think that's a question that, again, comes up, as you mentioned, since the beginning. Thanks so much. I really do appreciate it. The plan is for this to run tonight at 6, and we'll have something online too.
All right, brother. We'll see you later.